Once the heart stops, there is not enough time to harvest organs for transplantation because the organs also start dying. Now, in those cases where there is a brain stroke or an injury, some motorcycle injury where the brain is already dead, say in a younger person, that kind of person can be a very good donor for multiple patients.
Right.
You are watching Surgery Simplified, shastrakalasaralshabdomein.
Namaste everyone, welcome to Surgery Simplified, shastrakalasaralshabdomein. मेरे साथ हैं डॉक्टर निखिल बलजेकर.
नमस्ते व्यूअर्स.
वेलकम टू द शो डॉक्टर. आज हम कौन से नए टॉपिक्स पे डिस्कस करने वाले हैं?
आज का जो टॉपिक है महत्वपूर्ण है. वी आर गोइंग टू डिस्कस मेडिको लीगल एस्पेक्ट्स ऑफ सर्जरी. जो सर्जरी से संबंध कानून है उसके बारे में थोड़ी सी डिस्कशन करेंगे.
सर्जरी से संबंधित कानून
मतलब जैसे कंज्यूमर प्रोटेक्शन एक्ट है, जैसे नेग्लिजेंस का डेफिनेशन क्या है.
ओके, तो ऐसे काफ़ी सारे
एस्पेक्ट्स हैं. तो इसमें पहले मैं आपको बता दूं कि हर सर्जरी से पहले हमें पेशेंट का परमिशन लेना पड़ता है.
करेक्ट.
उसको बोलते हैं इन्फॉर्म्ड कंसेंट. वी नीड टू टेक ए इन्फॉर्म्ड कंसेंट फ्रॉम द पेशेंट, एंड यूजुअली दिस कंसेंट इज टू बी टेकन इन द लैंग्वेज ऑफ द पर्सन. फॉर एग्जाम्पल, as far as possible, if they can write down in their own language, it is better, or it is to be done in the presence of a witness from the patient side, which means a relative or somebody who can be a witness that the consent was taken in a language understood by the patient.
But काफ़ी बार ऐसा होता है कि जो patient है he is alone or maybe nobody is accompanying him. तो ऐसे सिचुएशन में क्या होता है?
नहीं, we'll come to that. That is only in an emergency situation.
Right.
लेकिन whenever it is a planned surgery, even if it is an emergency planned surgery, relatives तो होते हैं. So we have to take the relative or any person known to the patient, not necessarily a relative, anybody else who will be a witness.
Okay.
And there is a form in which the consent has to be taken in writing. It has to be signed by the patient or a thumb impression, signed by the witness and signed by the person who has taken the consent on behalf of the hospital or the surgeon. In some countries, it is the surgeon himself who has to take the consent, like in UK. But here it is not so. We have mainly our junior doctors who take the consent on behalf of the surgeon. Now, what is an informed consent? Informed consent means that we have to inform the person what is the surgery we are going to do, what are the possible other types of treatment possible, including non-surgical treatment, what are the possible complications that can happen in this, including the possibility of death.
Okay.
After he has understood all these things, he has then consented to give us permission to do the surgical procedure. So this is the way it has to be done. So this is very important to protect the surgeon if the case goes to court later on. Okay. So now we come to the point of what is a negligence. So negligence is that if there is any complication happening because average amount of care was not taken by the hospital or by the surgeon. Here the word average is very important. We may have some very brilliant surgeons, we may have some not so brilliant surgeons, but we take the average, what is the average surgeon would do in an average situation. Okay. So there are certain minimum requirements from the point of infrastructure, cleanliness, sterilization, equipment, then education, license to operate, both the anesthetist and the surgeon. All these are prerequisites. If these are not there, there is no case. Directly it becomes negligence. Therefore, the hospital has to provide the infrastructure, the sterilization, which we already discussed in our introduction to the operation theatre part, and the surgeons as well as the anesthetists have to be qualified. In the post-op period, you must have qualified intensivists to look after the patient in the intensive care and qualified RMOs to look after the post-operative patient. Now, despite this, there will always be cases where the patient feels that there has been negligence, the surgeon feels that absolutely there is no negligence. These will then go to court. Now, there are two ways. One is a civil case, the other is the Consumer Protection Act 1986. The only difference is in a Consumer Protection Act of 1986, what it does is that it allows the person to sort of get justice earlier than in the regular way, and the court fees are not there. For example, if a person is asking for compensation, then in a normal case they have to pay a certain percentage of what they are demanding as a court fee. In a Consumer Protection Act, there is no such thing. So this is one part. Now the other part is, as a spin-off of this, what has happened is that since 1987 or 88, when the Consumer Protection Act was made compulsory, the doctors and the institutions have also become a little more careful.
Right.
Now, as you know, India is a poor country and patients generally have to pay from their pocket, because only in the recent, say, 10-15 years, insurance companies have come in a big way in health insurance. Prior to that, the patients had to spend from their own pocket. Even now, most of the patients have to spend from their own pocket. Of course, government institutions are there, Ayushman is there, Rajiv Gandhi insurance scheme is there. There are some government schemes, but the number of patients are so large that in a government institution or in Ayushman scheme, there is too much of waiting period.
Right.
So many people are forced to go into private because sometimes treatment can't wait. Now in the private sector, what has happened is, like in the West, there is the introduction of defensive medicine. So because the Consumer Protection Act, anybody can go to court whether there is negligence or not, and put a case because there is no fees to be paid. So there is a tendency by some lawyers to do ambulance chasing, which means they encourage or instigate patients to go to court because they can get money.
Achha.
And some take advantage of the fact that they can make money out of illness, and so patients are also sometimes on their own want to go to court even if not necessarily there has been a negligence. With the result, doctors have become extra careful. They don't want to take up complicated cases, because if there is a death, then automatically either the patients don't pay the fees properly, or they go and threaten legal case so that they don't have to pay the money, and so on. So people don't want to take very, where they feel that the patient is serious. They over investigate, because if by chance something small, for example, a person comes with a headache, let us say, to a doctor. Ideally, it would be common things like maybe he has a refractive error and needs spectacles, or he has got migraine, right? And you give him tablets and it is all right. But now it is not like that. They will do a CT scan, because 1 in 1,000 or 1 in 10,000 person can have a brain tumor. Now if by mistake a person with a headache comes and you just give him tablets and he doesn't get all right, and after a month he goes to another doctor, he does a CT scan and it turns out to be a brain tumor, he'll come back to you and say, because you didn't do the CT scan,
Okay.
my brain tumor got diagnosed 1 month later and now I have to suffer because of that. And he put a case, and it could become a negligence. So now what will be the doctor's attitude after that? Every headache he will do a CT scan.
Right, right.
Actually, there is a statistic that in foreign countries, 99% of all imaging is normal. 99%. Because their suing is much more common. So cost of medical treatment has gone up. People ask, why do they write so many investigations? Because if you miss something, then it is likely to boomerang on you. So you become defensive.
Right.
That is not the way, and it's not a good way to practice medicine, but that is what has happened. So these are the spin-offs of these legal aspects. Now let us come to what is the definition of death.
As far as I know, or what I've heard is, the moment the heart stops working, the person is deemed
Yes.
dead.
So to declare dead,
Haan.
you need the following. A, the heart has to stop and you have to demonstrate it with a flat line on the ECG.
Okay, got it.
So there should not be any palpable pulse. On auscultating the chest, there should not be any heartbeat. There should not be any respiration. And the oxygen level will be 0.
Right.
And his pupils have to be dilated and fixed, indicating brain death. So lung is dead, heart is dead, brain is dead, and it is declared dead. But recently, well, not recently, maybe many years ago, maybe 15 years back, the definition of death was changed to encourage transplantation.
Acha, right.
Yeah, because once the heart stops, there is not enough time to harvest organs for transplantation, because the organs also start dying. Now, in those cases where there is a brain stroke or an injury, some motorcycle injury where the brain is already dead, say in a younger person, that kind of person can be a very good donor for multiple patients.
Right, correct.
Okay. So now the definition of death has been changed, that if a person is only brain dead, in special situations, he can be declared dead for harvesting organs. So if the patient is on a ventilator, 2 neurologists independently have to declare that the brain is dead, which means the pupillary reflex. What is pupillary reflex? When you shine a light, the pupils become smaller and then they come back to size like this. So pupillary reflex is not there. They are dilated and fixed. Corneal reflex means if you touch the cornea, the eye will close.
No, for a normal person.
Normal person, that is absent. The gag reflex, that means if you put something in the throat, you'll close the mouth. It's a gag reflex, is not there. There is no response to any pinching or pain by motor response. That means not moving after you pinch him or do some pain to him. Okay, and of course he is not responsive completely. So these things have to determine that the person is brain dead, and then the relatives have to consent for transplantation, in which case they will inform all the donors recipients who are waiting all over who are on the registry, and then they will harvest all the organs, the kidneys, the liver, the lung, heart mainly, sometimes pancreas and small intestine.
So you mentioned that the definition of death has changed over time, and majorly when the brain is dead.
Brain is dead, but heart is beating.
Heart is beating.
Yes.
So now when you said that there are a lot of registers happen for donors.
Yes.
So what is the time duration like?
Yeah. So generally for a kidney, it is good to do it within 24 hours, but even up to 48 hours, it's all right. And for the heart and lung, it is around 3 hours and 8 hours. 3 hours is ideal, but up to 8 hours.
Okay.
For the heart and lung. For the liver, it is slightly longer. Okay, it is 12 hours and 24 hours. So kidney is the longest, 24 hours. So most commonly in India today, we do heart transplantation, we do liver transplantation and kidney transplantation. We will discuss more detail about transplantation in the transplantation episode.
Alright.
So there are other aspects of a consent. For example, as I told you that we have to have a witness from the patient side. But suppose there is a situation where a patient comes with an accident, unconscious, and we have to operate him in emergency. Now the strangers bring him from the road. Let us say there is a road traffic accident. Nobody is related. There is no way to contact the relatives, and there is no time to waste because we have to start the treatment. So we have what is known as an implied consent. Implied consent. Whenever you walk into a person's consulting room or a hospital, you have already implied a consent. For example, let us say a person walks into a hospital, he sees some sight and gets a vasovagal attack and collapses. Now we have to resuscitate that person. We can't take his permission, but we have to institute cardiac compression or whatever it is to bring him out. So once he walked into the hospital, he has consented to any kind of emergency medical procedure which is required to save his life. So the implied consent applies in such cases. However, because it's an accident, you need to inform the police station and if possible the magistrate and take permission. But it is not necessary to wait for the permission.
Got it.
to start the treatment. So this is known as an implied consent. The other one was an informed consent, which is for planned procedures. This is an implied consent. Then what is the difference, or what is the two other terminologies I want to tell you. One is DNR and the other is euthanasia. Do you know what these terms mean?
I've heard about euthanasia.
Yeah.
If I can just maybe tell in a layman's term, and euthanasia is probably the consent that the patient himself or herself gives, that okay, I don't.
Yes.
You can,
so it is medically induced death.
Correct.
Okay. For terminally ill patients.
Right.
Now this is controversial. In some countries in the West, they allow the person to decide when he wants to die. The idea is that the life is his and he can decide when he wants to die. As of now in India, euthanasia is not allowed.
Not legal.
It's not legal. So medically induced death under the supervision of a doctor, which is called euthanasia, is not as yet legal in India. However, there is another term known as DNR. What does DNR mean? Do not resuscitate. Resuscitate means when a patient goes into arrest, the heart stops, we do compression, we do DC shock, we intubate, put on ventilator. That is known as resuscitation.
Okay.
So if you give a consent called DNR, for example, a terminally ill person with terminally ill cancer, lot of pain is there, and in the last days of his or her life, they are admitted in a hospital. We usually counsel the relatives and the patient that do they want DNR. So if they give consent for DNR, if the patient dies, we allow him to go slowly. We do not interfere by way of trying to resuscitate and keep him alive or her alive. That is also very important. This is a situation we very frequently have in many hospitals. And the third thing is related to this is a patient is there on a ventilator. Okay, and again same problem that maybe he is not fit for transplanting because he has a lot of illnesses, but he is on a ventilator. Now the ventilator is keeping him alive. There is a situation involved when the cost and the futility of keeping patient alive is of no use. Everybody feels, all the treating doctors, that machine is just keeping him alive and he is already gone or she is already gone. Then they counsel the relatives about turning off the ventilator.
Correct.
Now this becomes a very emotional decision.
True.
But unless the relatives give consent to turn off the ventilator, the hospital cannot do that.
Got it.
So this is the another form of consent related to DNR, but it was not given earlier. But they thought that maybe because of the ventilator patient may recover. But is not recovering, is becoming worse or she is becoming worse. In such a situation, the consent for switching off the ventilator is taken. It is also related to an accident victim where if we counsel and they allow for transplantation, then also the consent of turning off the ventilator is taken.
Got it.
So these are some of the medico legal aspects of related to surgeries, which I thought is important for all people to be aware when they go to a hospital.
Definitely. That was very informative actually. Thank you so much, doctor.
Thank you.
So this was the end of our episode where doctor gave us a lot of important information about the medical aspects. So hope it was very useful, and if you have any questions, you can put through us on the comments, and if you want doctor to put some light on some other topics that you feel okay, it's very important for you, you can let us know on that as well, and we'll make sure that we do something about it and create a video around it. So please, if you like this episode, subscribe our channel, hit that like button, and please press that bell icon for notifications, and stay tuned for more interesting episodes. Thank you.
Thank you.